We are going to restore the distal of the second bicuspid in composite. You can slightly see some decalcification on the distal marginal ridge. We're going to do this with a clear custom matrix that we take after inserting a sectional matrix and a C-clamp.
There's some caries in here. We put a sectional matrix in between the teeth, put on our C-clamp. We're going to now take an impression adjacent to that sectional matrix with our clear bite registration material. Now, any material that goes over the edge, and this goes for, and this is something I didn't mention recently or at all,
Any clear bite registration material.
It goes over the edge of your matrix band or your sectional matrix can only interfere with you reseating that custom matrix later on. So this should be cut off. Not a big problem. You can do it with your number 12 blade or a pair of scissors. But any of this excess material that gets beyond this can interfere with you reseating it later on if your sectional matrix is not in exactly the same position. So I cut any of this off. And here we have custom matrix, and it looks like a piece of junk. There's a tremendous amount of surface detail information trapped in that surface.
This custom matrix will be used later on in the procedure as a die to force the unset composite into its original contours, eliminating polishing, finishing, and adjusting, and saving the operator and the patient 5 to 10 minutes of chair time.
So we've cut our preparation, put our sectional matrix back on with our clamp.
Acid etch and bond, placing and curing composites in increments, making sure that the last increment is only a slight excess before forcing the clear custom matrix back into the unset composite and curing through it, curing in the original anatomy and surface texture. The clear custom matrix is forced into the last increment of unset composite with pressure for 5 to 10 seconds. Then the light curing bundle is placed on top of the clear custom matrix, and the composite is light cured through the clear matrix for the normal amount of time, curing in the original anatomy, surface texture, and occlusion that the patient was comfortable with when she walked into the operatory.
And there's our final restoration. I don't do this, I don't use a sectional matrix often because I have difficulty getting the sectional matrix through the contact in a tooth that has not been prepared. If you really want to do that, what I've found, and it works, I have to pre-wedge the tooth or wedge the tooth to break the contact a little bit, put a sectional matrix through there, and then make my custom matrix. So here are some of the materials. I've used every one of these materials. Every material is a polyvinyl siloxane bite registration material. It's not made for this technique. It's made for making bite registrations. And so they can't charge any more for this than they do for any other bite registration material because most of this material is sold as bite registration materials. I'm using like a millimeter or milliliter or two of this material to make what is called a custom matrix. And I use that custom matrix to reform my composite. So just some examples of some of the materials that are made, and these are in your handout. And I don't push any one of the particular materials. They all work. I would pick one with a short working time because you don't need a long working time to take this type of impression.